A 21-year-old woman comes to the physician for a follow-up examination. 4 months ago, she underwent posterior arthrodesis for thoracolumboscoliosis, and she has recovered well from the surgery, but noticed difficulties combing her hair with her right hand. A photograph of the patient's back is shown, and the nerve that most likely injured in the surgery originates from which of the following spinal cords? So here are the options. So here is the image, like if you guys have seen them, and these are the options. Okay, so here, yeah, so these are for the nerve roots. All right, so here we can see this is the winging of the scapula we've already seen, and we all know that it's caused by which nerve? We've discussed that already, the long thoracic nerve, right? So the long thoracic nerve, so this is something that you have to remember, because you know the diagram of the brachial plexus. So we have a lot of things coming out. So just before all these trunks are formed, there is one nerve which originates directly from the roots, these roots, that's the C5, C6, C7, and that is the long thoracic nerve. So it would be great if you could remember this, because before even the trunks or divisions are formed, there is a nerve which directly arises from the roots, C5, C6, and C7, and that is the long thoracic nerve, which causes winging of the scapula. So we have quite a number of questions on winging of scapula. So I guess that's really important. So just to remember this, okay? So all the other nerve roots, T8 to T1, it is the lower roots, right? So what is the disease that is caused by lower root compression? All right, so the lower trunk can cause a clump-case palsy, and the clump-case palsy causes the complete glowing of the hand. Okay, so that's what happens with clump-case palsy. Okay, and C6 to C8, that's not important, because that is the supply of, I guess it's thoracodorsal nerve. Yeah, it's a thoracodorsal nerve which causes C6 to C8. It's not very important to remember that. And C1 to C3 is the ansa cervicalis. Okay, so that causes problems with swallowing and speech and stuff like that. And C3, C4, C5 is the phrenic nerve root, and they will usually present with respiratory distress, breathing problem, and asymmetric breathing movement if it is unilateral. So that's about C3 to C5. And T2 to T5, these are the intercostal nerves. So T2, T3, from all these, from T1 to rest, we have intercostal nerves which arises. And as long as the diaphragm is functioning properly, so you will not have any, I wouldn't say any, but no much symptoms are present. Okay, so because diaphragm, these are accessory muscles, no? Diaphragm is the important muscles for respiration. So C5 to C7, this one thing you have to remember, as a nerve which arises before the trunk or before anything else arises, directly from the roots, C5, C6, C7.
Thanks for watching. Please give a thumbs up and subscribe for more.